Night curfew will be imposed in Delhi from 11 p.m. to 5 a.m. starting today, the city government said, as the national capital reported 290 fresh cases of COVID on Sunday. That's a 16% jump and one related death in 24 hours. The case positivity rate has climbed to 0.5%, a critical level, and could trigger the yellow alert if it remains there for 2 consecutive days. Most activities that were resumed in phases as the second wave waned will come to a grinding halt if this yellow alert is sounded. Well, let's go across to Shunakshi for more. Shunakshi, tell us more about what the yellow alert entails.
Well, Harji, I want to begin by saying that the Delhi has reported 290 cases of COVID on Sunday, which has been a big high in 6 months. It's the highest we've been seeing for the last few days. We have been reporting over 200 COVID cases, and which is why the Delhi government has first gone on to ban public gatherings, which was ahead of Christmas and New Year's, and now they have gone in for that night curfew from 11 p.m. to 5 a.m. Now, essentially, under the Delhi government's GRAP program, which is the Graded Response Action Plan, if the positivity rate stays at 0.5% for the next couple of days, then a yellow alert will be sounded. Now, under the yellow alert, what will happen is most activities that had already resumed now will again go back to a specific curfew timing, and all operational timings of shops and malls and selling non-essential goods and services will be restrained. They will be allowed to open from 10 a.m. to 8 p.m. under the odd-even rule. So remember, earlier this year, Delhi government, including adjoining areas in the national capital, had gone in for this odd-even rule, and they had put timings over non-essential activities. So if under the yellow alert, restaurants also in the city will be allowed to operate at 50% capacity. So all the non-essential activities and services will have a partial ban and a curfew timings on them under the yellow alert. If the positivity rate in the city stays at 0.5%, that critical level, that critical mark for the next couple of days.
All right, Shunakshi, thanks so much for joining us with those details. And from Delhi to Mumbai now. Mumbai today reported 922 new cases of coronavirus that were detected in the last 24 hours, a 21% jump from the day before when the metropolis logged 757 cases. It's the city's highest single-day spike in nearly 7 months. On June 4th, Mumbai had reported 973 cases in a day. The jump in cases comes amid renewed global fears over the new variant of coronavirus, Omicron. 2 related deaths were also reported. The city's active caseload now stands at 4,295 cases, and the positivity rate has jumped to 2.64%. So if we take a look at the Omicron numbers in the country, they remain low, and these are just the detected cases. 436 cases of Omicron in the country. Maharashtra has the highest with 110, followed by Delhi with 79 cases, then Telangana, Karnataka, Tamil Nadu has 34, Gujarat has 43, Rajasthan has 22, Haryana 5, Odisha 4, West Bengal has 3, and Chandigarh has 3. Ladakh, Uttarakhand, Madhya Pradesh and Himachal has 1. Madhya Pradesh has 8 cases of Omicron so far. Now, in Union Territory of Chandigarh, 2 more Omicron cases have been detected. Samples of 5 family contacts of a previous Omicron positive case were sent for genome sequencing to the NCDC. 2 of these were found to be positive for the Omicron variant. One of them is an 80-year-old male who is a patient of hypertension but is asymptomatic. The second, a 45-year-old male who was reported as RT-PCR negative on the 24th of December and stands discharged. The genome sequencing report of the remaining 3 remains pending. Now, in view of the increasing cases of corona across the country, strictness has been increased by many states. But despite this, large crowds of people are present at election rallies in Uttar Pradesh, including metro cities like Delhi and Mumbai. But only those who make the rules are seen to be breaking them as well.
Despite COVID restrictions and multiple appeals by the authorities, crowds came out in large numbers. This when Delhi reported its highest single-day spike in over 6 months, and Mumbai its highest one-day spike in nearly 3 months. Delhi reports 290 COVID cases in the last 24 hours, which is the highest daily rise in over 6 months. In Mumbai, 922 new COVID-19 cases have been reported, which is the highest in nearly 7 months. A school in Maharashtra's Ahmednagar had to be sealed after 33 more students were found to be COVID positive on Sunday, taking the tally of infected students to 52. Amid the looming threat of Omicron spread in India, political rallies continue through the day as many states have imposed night curfews.
दुनिया के कई देशों में कोरोना के नए वेरिएंट ओमिक्रॉन की वजह से संक्रमण बढ़ रहा है। भारत में भी कई लोगों के ओमिक्रॉन से संक्रमित होने का पता चला है। मैं आप सभी से आग्रह करूंगा कि पैनिक न करें। हां, सावधान रहे, सतर्क रहे, मास्क उसका भरपूर उपयोग करें और हाथों को थोड़ी थोड़ी देर पर धुलना, इन बातों को हमें भूलना नहीं है।
In poll-bound Uttar Pradesh, not only the ruling party but the Congress also was found to be violating COVID protocol. On Sunday morning, a marathon was organized on behalf of Congress General Secretary Priyanka Gandhi Vadra, an event that the party defended.
मैं आदरणीय प्रियंका गांधी जी का मंच पे बैठे हमारे सभी
प्रियंका गांधी के लिए एक मापदंड और मोदी जी के लिए 25,000 स्पोर्ट्स पर्सन इकट्ठे करने का एक दूसरा मापदंड, और ये है प्रधानमंत्री के लिए 25,000 लोग सरकार के पैसे से, सरकार के खर्चे से सरकारी आयोजन किया जा रहा है। एक राजनीतिक व्यक्ति और एक राजनीतिक दल तो नुकसान उठाने को तैयार है जनहित में, पर माफ कीजिए, सरकार की जवाबदेही और जिम्मेवारी क्या है।
With Sohit Mishra in Mumbai, Bureau Report, NDTV.
The Election Commission of India will convene a meeting today with senior officials of the Ministry of Health and Family Welfare, including Secretary Rajesh Bhushan. The meeting will discuss the prevailing COVID situation for the upcoming assembly elections in 5 states. Recently, a judge of the Allahabad High Court had asked that UP elections be postponed in the face of the threat from the Omicron variant. The Election Commission has said they will look into this matter. The first case of the Omicron variant has been reported in Gurugram in Haryana. A man aged 30 years arrived from the UK on the 10th of December and tested positive on repeat RT-PCR test on the 18th of December. The sample was then sent for genomic sequencing and it was found to be positive for the Omicron variant. NDTV's Mohammad Ghazali sent us this report.
So this is a 30-year-old male patient who has returned from United Kingdom on 10th of December, and he was tested positive on RT-PCR testing which took place on 18th of this month, and his sample was then sent for genome sequencing and the reports have come today. So in total, Haryana has got over 6 cases and 2 districts have reported their first cases today. One is Gurugram and the other is Panchkula, and in both the cases and in all the cases, most cases, the person or the infected person is a foreign returnee or who has returned from abroad.
So across the world, the impact of the Omicron variant is being seen, with the UK reporting record cases, France reporting 1 lakh daily cases for the first time, and high number of cases being reported in the United States as well, which have led to calls for vaccine boosters and restrictions. Now, there's also been talk of the Omicron variant being milder than the Delta variant. However, some doctors say this is a dangerous trap to fall into. The fact that Omicron can evade vaccine immunity is a huge worry, and the fact that it's more infectious is a matter of concern. We're now joined by Dr. Dipti Gurdasani, who is a lecturer and epidemiologist from London. Thank you so much for joining us on the program. Now, you've spoken out about how overall Omicron causes severe disease and how we shouldn't get complacent. If you could explain that.
So I think it's important to understand that Delta and Omicron are infecting different groups of people. So Omicron, the huge part of the advantage that it has is it's able to penetrate through some of the vaccine immunity and some of the previous immunity that we have to Delta. So it's able to infect people that Delta wasn't able to infect. Now, because these people have previous immunity, obviously they have some level of protection against things like hospitalization. So if you compare overall the people who are infected with Omicron to overall the people who are infected with Delta, then it might look like it's less severe. But the fact is that it's infecting people who were not previously at risk from Delta. So for example, if you have 2 doses of vaccination, you have much less protection against infection with Omicron, but you were much more protected against Delta. So it's infecting people who wouldn't have been infected before. And even if they have some protection against hospitalization, which they do, their overall risk is still higher than it was before with Delta. And I think that's what we have to really look at, because whether you get hospitalized depends on 2 things. One, what is the chance of you getting infected? And if you get infected, what is your chance of getting hospitalized? And your protection against Omicron, against infection, is now much lower because it's able to escape vaccines much better. So that means overall your risk of hospitalization is actually higher. But the reason people think that it looks milder is because they're making sort of unfair comparisons between all the people infected with Delta and all the people infected with Omicron. And you're much more likely to be infected with Omicron, if you have previously been vaccinated or infected. You still have good protection against severe disease, but it's the sheer rate of infection that puts people at risk, if that makes sense.
All right. So the rate of infection is what's concerning. Also, the immunity escape. So, Doctor, what is the situation now in the UK? And we've seen that the surge in cases in South Africa seems to have receded as quickly as it went up.
Yes. So, I mean, certainly the Gauteng and other provinces look like the infection has peaked. And there might be several reasons for that. One of the reasons might be that schools closed. So schools closed, I believe, first to second week of December. In Gauteng, there was a holiday started, which is where a lot of people leave. So there may have been behavioral changes. The second thing that I think a lot of scientists are wondering about is whether the time from somebody getting infected to be able to infect somebody else is smaller for Omicron. And if that is the case, then what you tend to see is very, very, very quick rise in infection, but you can also see very, very quick falls in infection. But that doesn't mean that a lot of people won't get infected in that process, and that a lot of that will translate into hospitalizations. So Gauteng did see a lot of hospitalizations. It was less than expected from the number of cases, which makes sense when you think of who Omicron is infecting. It's infecting people who likely have past infection or vaccination. So their outcome will be better overall, but it can still burden health systems a lot because of the number of people infected. So in London, for example, now when we're feeling the impact of the variant, we're seeing hospitalizations double each week, which is quite similar to what was seen in Gauteng right at the beginning. But it is possible that it will peak earlier. Part of that might be behavior change. Part of that might be the variant being able to infect people faster and reach the peak and then come down again. But I think we have to wait and see. But in the meantime, health systems are being burdened quite a lot. So it's not that this is not a serious crisis. It is.
All right, and that is the worry, healthcare systems are being burdened. So what do we now know about the virus? There's some reports also suggesting that it doesn't cause that, dip in oxygen like we saw during the Delta wave.
I mean, I think there's very, very, very early evidence that Omicron might be potentially associated with a shorter duration of hospitalization, but we don't really know that exactly yet. Again, part of that might be that it is infecting people who were previously protected against infection and now are getting infected but have some protection against severe disease. So it might again be down to the population that's getting infected. But I think we have to remember these are people who wouldn't have been infected by Delta. So overall, their risk has increased, even though for the number of cases that we see, the severity might appear lower.
All right. And now in India, we have finally announced vaccines for the age group of 15 to 18 years and also boosters for frontline and healthcare workers, also elderly with comorbidities. And we're holding that, this will help our population when that surge from Omicron comes. So
I think boosting is vitally important, but I think given that it's been started now, it's not going to be a very, very quick response. And this is a variant that everywhere it's been seeded has spread very, very rapidly. And by very, very rapidly, I mean over about 2 weeks. So my advice would be, one, try and slow down the variant as much as you can by having sort of restrictions or quarantines and pre-screening of travelers. But also take other measures to reduce community transmission. Boosting by itself, because it takes time, will not be sufficient. So what I would say is masks, not just sort of cotton and surgical masks, but, high-grade masks, which I think the government should provide, FFP2, FFP3 masks. Again, focus on ventilation. So try and limit socializing indoors. If you do meet people indoors, keep your windows and doors open, maintain that distance. All of those things together. And if you have symptoms, even if you have a scratchy throat or sneezing or runny nose, all of these are symptoms of Omicron. You don't have to have a fever or a cough. Do get tested, because that helps catch infection early and prevents other people getting infected.
All right, and don't go out anywhere if you do feel a scratchy throat. And finally, Doctor, many of the states right now have announced night curfews. Delhi is under night curfew now. There's been some amount of criticism and pushback on this. What is your view on night curfews?
I mean, my view on curfews is mixed. I mean, to be frank, during the Delta wave, curfews were completely inadequate. I mean, in most countries, we didn't see curfews turn around the spread of the variant. So I don't think they're the most effective measure by government. I think there are many, many other measures that could be taken. And I think the government really needs to stress this sort of multi-layered approach and make the public aware that this pandemic isn't over and this variant spreading can lead to serious crises, and that people need to take that action, support them in taking that action, support them financially where they need support for isolation. I don't think curfews by themselves would be adequate to stem the spread of the variant, given what we've seen in other countries.
All right, Dr. Deepti, thank you so much for joining us on the program this morning. News now from the northeast, and India has seen a rise in cases of violence against religious minorities. Recently, churches have been attacked and Christmas celebrations disrupted in many places. In Assam, Silchar as well, there was a major commotion in Church Road when right-wing group members disrupted Christmas celebrations at night, forcing hundreds of people from different religions to leave the church premises. Now, the members, who claim to be from the Bajrang Dal, stopped the Christmas celebrations. The oldest Presbyterian church in the region situated in Silchar organized several programs during Christmas, and like in the past, people from all religions visited the church in the evening. After media reports of disruption of the Christmas celebrations, the police then detained 2 young men who are said to be supporters of the Bajrang Dal. The police has taken cognizance of the videos of the commotion that went viral on social media.
আউটসাইডার মানুষ যে এন্ট্রি আউটসাইডার মানুষটা এন্ট্রি আমরা বহুত খারাপ লাগে। দেখুন, আমরা আজকে সকালে গেছে একটা তুলসী দিবস, কেউ জানে না এই জিনিসটা যে তুলসী দিবস। আজকে সকালে তুলসী দিবস উদযাপন করতো তারা রাস্তায় রাস্তায় বক্স বাজার, মেরি ক্রিসমাস মেরি ক্রিসমাস, এখানে মোমবাতি জ্বালার ফটো উঠে, এটা একটা যুক্তিসঙ্গত মাত হয় না। আমরা চাই সবে ক্রিসমাস করতে।
And it wasn't just Assam. A statue of Jesus Christ was vandalized at a church in Haryana's Ambala in the afternoon yesterday. The police are analyzing the CCTV footage but haven't yet been able to identify the criminals. Very, very disturbing visuals of the Jesus Christ statue just lying there on the side. Earlier, Christmas carnival was disrupted in Haryana, a private school, by a right-wing mob. That was on Thursday.
उन लोगों को पकड़ने के लिए हमने प्रयास शुरू किए। 3 टीमें, एक CIU 1 के नेतृत्व में, एक CIU 2 के नेतृत्व में और एक SHO अम्बाला कैंट के नेतृत्व में हमने गठित की। CCTV फुटेज हमने हासिल कर ली है। उसमें 2 लड़के इस वारदात को अंजाम देते हुए नजर आ रहे हैं। हम उस CCTV की जो फुटेज है उसके आधार पर हमें उम्मीद है कि जल्दी ही हम ऐसे तत्वों को गिरफ्तार कर लेंगे।
In other news now, in a major development, Nagaland government has announced that the centre has decided to form a committee to look into the withdrawal of the controversial Armed Forces Special Powers Act in Nagaland. Chief Minister Nephew Rio tweeted, "This comes after last week the Nagaland Assembly unanimously resolved to demand a repeal of AFSPA from the northeast, especially the state. 14 Naga youth from Mon district were killed in a botched-up army operation earlier this month that had resulted in a widespread protest. The main opposition Congress has, however, demanded the resignation of Union Home Minister Amit Shah for allegedly lying in the parliament about the incident.
Nagaland Chief Minister Nephew Rio tweeted that centre has decided to form a committee to look into withdrawal of Armed Forces Special Power Act from Nagaland. The committee will submit its report in 45 days and a court of inquiry against the army personnel involved in the firing to be initiated. All those against whom a probe is initiated will remain suspended. And also, government job for next to kin of the 14 youths who have died in firing. These decisions were taken in a meeting between Amit Shah, Nagaland CM, and his deputy Patton, and former Chief Minister T.R. Zeliang, and BJP's Northeast go-to man and Assam Chief Minister Himanta Biswa Sharma on 23rd December in New Delhi. The timing is significant, as last week Nagaland Assembly passed a resolution seeking centre to repeal AFSPA from Northeast. Pressure had been mounting ever since the killing of 14 youths in Mon district on December 4 and 5 by armed forces, leading to widespread protest in the area, including total non-cooperation with the armed forces. Amid mounting protests, the army today expressed regret over Nagaland killings, loss of lives sad and unfortunate.
कांग्रेस पार्टी का स्पष्ट डिमांड है और डिमांड पर ही आ जाता हूं। एक तो असत्य का शहंशाह अमित शाह को तुरंत इस्तीफा देना चाहिए, क्योंकि इनकी आदत सी बन गई झूठ बोलना। आप तो पार्लियामेंट में ही लगातार झूठ बोलते हैं।
Army assures justice to the people of Nagaland. The victim families from Nagaland's Oting village say justice is all they want.
Gramin brado, jopi dibo, poisa dibo, inaga koirage. Husage kune marise, ki hoise, ki naga hoise. It is sop to amikanto, evident, pavo lage.
There is an anger like never before. There's intense pressure from the public on the civil organizations. The government has shown today, after meetings with the Home Minister, it's a good move that they've done something, but I doubt it'll be very simple, for the civil organizations to retract their demands as of now.
Government's move to review Armed Forces Special Power Act is definitely a welcome move, but one has to wait if the protesting groups climb down from their demands of trial of the army jawans in civilian courts and an apology from no less than Union Home Minister. In Guwahati, Ratndeep Chaudhary for NDTV.
Welcome back. BJP National Yuva Morcha President and MP Tejasvi Surya has sparked another controversy after on Christmas he said all religious mutts should take the initiative to bring back people from other religions to Hinduism. The clip is going viral on social media. Tejasvi was speaking at the Sri Krishna Mutt and he said that the work of preventing religious conversion and bringing back those who had converted from Hinduism to other religions should happen on a war footing. His remarks came 2 days after the Karnataka Assembly passed the controversial anti-conversion bill despite increasing opposition.
The Hindu has been taken out from his mother religion. There is only one possible solution. There is only one solution to address this anomaly. Those people who have left their mother religion and have for various socio-political economic reasons over the course of India's history, those who have gone out of the Hindu fold must be brought back in whole, brought back into the Hindu faith, brought back to the mother faith.
In other news, a group of lawyers submitted a representation to the Chief Justice of India, N.V. Ramana, urging him to take suo motu cognizance of hate speeches calling for genocide of Muslims at 2 events in Delhi and in Haridwar. In the letter, the lawyers said that between the 17th and 19th of December, at 2 separate events organized in Delhi by the Hindu Yuva Vahini and Haridwar by Yati Narsinghanand, hate speeches consisting of open calls for genocide of Muslims in order to achieve ethnic cleansing were made by Yati Narasimhanand and 8 others. Speeches pose a grave threat to the unity and integrity of our country. It is also pointed out that the recent speeches are a part of a series of similar speeches that we have come across in the past. Initially, the FIR in the case in Haridwar named a former Shia Waqf Board chairman, Wasim Rizvi, who had recently converted to Hinduism, and on Saturday, the names of 2 others were also added. Well, to talk more about this, we're now joined by Sanjay Hegde, Senior Advocate, Supreme Court, and Ashutosh Srivastav, Advocate, Supreme Court, someone who also supports the BJP. Sanjay Hegde, first to you, this letter comes after a week since that occurrence, since what happened in Haridwar, and very little by way of, investigation or probing the issue. Yes, an FIR has been filed, but as NDTV has been reporting, nobody's been summoned. There doesn't seem to be a real push to investigate the matter.
Well, that's what happens in a lot of these cases. After all, in every riot, the slogan often is "Andar ki baat hai, police hamare saath hai." It does not look correct that lawyers have to write to the Chief Justice of the Supreme Court saying, look, calls for genocide like this are a signal that things have gone and hate speech has gone beyond acceptable limits. There are laws which deal with hate speech. They need to be implemented. And the lawyers have petitioned the Chief Justice that the court needs to take suo motu action on this.
That's right. Ashutosh Srivastav, your reaction to this development of lawyers writing to the Chief Justice, and how does one, justify the fact that the police are going so slow on this case where you have literally a call for genocide, a call, for eradicating Muslims, a call for a Hindu nation?
Yes, I do feel that, using the words like genocide of a particular religion is completely unconstitutional. It is unparliamentary. And, the police should have taken certain actions. However, if they have not done and no FIR, nothing has been registered. So obviously the next, the course is to go to the court and get such an order. And I think the lawyers have rightly written to the Chief Justice. And I'm sure that, the court will come up with some kind of an order and some kind of directions to the authorities, to take actions in the matter. I do not feel that the government, is promoting anything like that, and the government has to do anything with this. This is, has been done by certain, group of people who have, given such kind of speeches. Those are hate speeches.
In fact, one of the reasons being seen, or, that people are thinking the reason why the police is going slow is because some of the members of this gathering that took place are seen to be close to BJP members. We've seen pictures of Uttarakhand Chief Minister touching one of their feet, and we've seen another picture of one of them with the UP Chief Minister. So, there's this sense that they have some political patronage, which is the reason we're seeing the police go slow.
No, see, I feel that it is a matter of investigation, of course, and whoever it is, whoever party or anybody, whoever is involved in, doing something which is against the public policy, which is against the constitution, which is against the laws of this country, obviously they all should come under the scanner of the, investigating agency, and nobody should be spared. And, as a whole, I don't think that it is being promoted or being done by the government agency. However, as you said, that if somebody is specifically any person belonging to any particular political party is involved, should also be under the scanner, of course. Why not? This is a country that we follow the constitution, we follow the laws of this.
Sanjay Hegde, we have this situation where you have these blatant hate speeches, calls for genocide being made openly in a gathering, and pledges being taken, and then, and compare how slowly the police is going on this with what we saw earlier when, the anti-CA protests were happening. There you had UAPAs, being slapped on people left, right and center. And here you have, this obvious hate speech being made, and the action is laughable, given it's been over a week since this event.
Critical to the rule of law in any country is the even-handed application of it. What is sauce for the goose is sauce for the gander. If those speeches which caused UAP action to be taken against certain communities was have to be justified, there have to be equally strong action on this side. And I'm not for a moment saying that those speeches were right, wrong, or whatever. But if you took action against those against speeches in Delhi, you have to take the same action against speeches in Haridwar. And the speeches in Haridwar seem to have been way more than what was said in Delhi.
And this only emboldens, the sort of what we're seeing across the country. We've seen Christmas celebrations being disrupted in various parts. You have BJP MP Tejasvi Surya now asking for ghar vapsi of all the Muslims and Christians. So, we're seeing a lot of these incidents taking place in different parts of the country, in different states.
Absolutely, it's part of a pattern. Now, there are people who say that we are living in an undeclared Hindu Rashtra. Maybe, may not be, we're not going there. But essentially saying that it is only those who follow the Hindu faith who are ideal citizens of this country is entirely unconstitutional. To ask people to change their faith, to ask people to convert from one faith to the other is something which is just not done. Or to say that there will be a majoritarian faith with state backing, that is entirely against what the Constitution stands for. The Constitution allows freedom of conscience, freedom of religion, freedom to profess, practice and propagate religion.
Ashutosh Srivastav, your response to that, this sense that so many of these incidents are occurring. You have Tejasvi Surya calling for, ghar vapsi of Christians and Muslims, and you have the police going slow on a case like this, which has led to the lawyers actually coming together, asking the Chief Justice, since nobody seems to be doing anything, that you please take notice of this.
I feel even the court should take action against the errant officers, police officers who have failed to, discharge their duties properly, which they are expected to as per the constitution of our country. Obviously, the action should be taken against them. So far as Mr. Surya's statement, which I heard, I think it was basically about, some of the people who got converted into Muslim from Hindus. He is asking for those people to get reconverted or whatever. But I think that those statements in this kind of a scenario should be avoided when we see that a lot of other hate speeches are happening across the country.
And we've also seen a lot of attacks happening, and targeting of Christians and churches in Karnataka in the last couple of weeks, and now various cases over Christmas as well.
Yes, so I think law and order has to be maintained in the country, and that should be the responsibility of all the authorities who are working. And obviously the government should also, take cognizance of this issue, and the courts are already doing the same. And there are many petitions pending before the Supreme Court also on all these lines. And I'm sure things will come up into the proper,
All right, well, we'll have to wait and see what the response to that letter will be. But thank you so much, both of you, for joining us on the program today to talk about these very, very important issues and concerning issues that we're seeing. And yes, the police too should act, and there should be action against them if they don't do their duty to citizens. Thank you. In other news now, Kanpur businessman Piyush Jain has been arrested for evasion of goods and services tax. Mr. Jain recently made headlines after pictures of a raid at his premises showed officials counting heaps of currency notes with note counting machines, which went viral. 180 crore rupees in cash was finally seized from his home. The Directorate General of GST Intelligence has recovered more cash from a factory and residence of the perfume businessman Piyush Jain, a promoter of the Odechem Industries of Kannauj district in UP. Unaccounted sandalwood oil, perfumes worth crores have also been seized from Mr. Jain's factory. Welcome back. News from Kerala now, where 50 migrant workers have been arrested after a midnight fight among the migrant workers, also an attack on the police. Let's go across to Sneha for more on this story. And Sneha, what led to the fight among the migrants? It was something to do with the Christmas festivities.
Well, Gargi, this incident, according to the police, happened on late Saturday night, and as of today morning, there are 50 migrant workers who have been identified and arrested. Police say even more are likely to be arrested in days to come. This has taken a lot of people by shock with what happened on Saturday night. Well, according to the police, this was part of a labor camp, a migrant workers labor camp, where all the people who were living there belonged largely to the Kitex Apparel Park, is what the police have said. And according to the cops, so it was on late Saturday night, there was carol singing and some celebrations which were going on. One group wanted to continue it. It was past 9:30 when the arguments first began, and the other group wanted it to stop. And things just spiraled. Once the police reached the location to disperse the crowd, even they were attacked according to the police. There were stones that were pelted. You can see the visuals. One police vehicle was set on fire. The other police vehicle was completely destroyed. There were around 8 police personnel that have been injured in this. Police have said that a lot of the migrant workers who are accused in this case were also under the influence of alcohol. So all of this being probed currently, the police also looking into the larger picture, if there was something else that was involved, some other motive that was involved. But as of now, 50 migrant workers have been arrested for what began as a clash between migrant workers and then eventually spiraled into a law and order situation where even the police and their vehicles were targeted. Now, there are 2 kinds of cases that have been taken. One, attempt to murder, and second, destruction of public property. There are likely to be more cases also that would be taken as this investigation continues. Gargi, back to you.
All right, Sneha, thanks so much for joining us with that update. So 50 migrant workers arrested after the violence. Now, BJP National Yuva Morcha President and MP Tejasvi Surya has sparked yet another controversy after on Saturday 25th, he said that all religious mutts should take the initiative to bring back people from other religions to Hinduism. The clip is going viral on social media. He was speaking at the Sri Krishna Mutt on Christmas, where he said that the work of preventing religious conversion and bringing back those who had converted from Hinduism to other religions in the course of India's history should happen on a war footing. His remarks came 2 days after the Karnataka Assembly had passed the controversial anti-conversion bill despite increasing opposition.
The Hindu has been taken out from his mother religion. There is only one possible solution. There is only one solution to address this anomaly. Those people who have left their mother religion and have for various socio-political economic reasons over the course of India's history, those who have gone out of the Hindu fold must be brought back in whole, brought back into the Hindu faith, brought back to the mother faith.
A group of lawyers on Sunday submitted a representation to the Chief Justice of India, N.V. Ramana, urging him to take suo motu cognizance of hate speeches calling for the genocide of Muslims given at 2 events in Delhi and in Haridwar. In the letter, the lawyers said that between the 17th and 19th of December, 2 separate events organized in Delhi by the Hindu Yuva Vahini and Haridwar by Yati Narsinghanand, hate speeches consisting of open calls for genocide of Muslims in order to achieve ethnic cleansing were made. Yati Narsinghanand and 8 others. Speeches pose a grave threat to unity and integrity of our country. It is also pointed out that the recent speeches are a part of a series of similar speeches that we have come across in the past. Initially, the FIR only named former Shia Waqf Board Chairman Wasim Rizvi, who had recently converted to Hinduism and changed his name to Jitendra Tyagi. On Saturday, the names of 2 others were also added. Time for us to slip into a short break. Coming up on the other side, Delhi is on the brink of a yellow alert. We'll get you more details. Welcome back. Night curfew will be imposed in Delhi from today from 11 p.m. to 5 a.m. And as the national capital has reported 290 fresh cases of COVID on Sunday, a 16% jump and 1 related death. In fact, more news coming in of Omicron cases have now increased to 142 in the national capital, which is the highest in the country. So Delhi reporting the highest numbers of Omicron cases. Now the case positivity rate has climbed to 0.5%, a critical level, and could would trigger a yellow alert if it remains there for 2 consecutive days, which will mean that many activities will have to stop if yellow alert does come into place. So Delhi reporting maximum Omicron cases. It's tally at 142, so overtaking Maharashtra in the highest number of Omicron cases in the country. Now, if we talk about Mumbai reported 922 new cases of coronavirus on Sunday, 21% jump from the previous day when they logged 757 cases. It's the city's highest single-day spike in nearly 7 months. It was on June 4th that Mumbai had reported 973 cases. So a jump in cases comes amid renewed global fears of the new variant of coronavirus, Omicron. 2 related deaths were also reported in Mumbai. Well, to talk more about the situation, we're joined by Dr. Mufazzal Lakrawala, advisor BMC for COVID jumbo facilities, Dr. Sulfi Nuhu, President IMA Kerala, and Dr. Arun Gupta, President Delhi Medical Council, Senior Pediatrics, Fortis Hospital. Thank you so much, doctors, for joining us. And first to you, Dr. Lakrawala, cases are rising. Now Delhi has overtaken Maharashtra for the highest number of Omicron cases. So it does look like that surge in that third wave is inevitable. Also, the Prime Minister's announcement of booster doses was very, very welcome. But it's not going to ward off this third wave, is it?
Good morning, Gargi. Well, the Omicron is well and truly here. We are probably not testing all the positives for genomic testing. So probably we don't know the true number of Omicron cases. But we do know that it's much, much more transmissible as compared to the Delta. So even one Omicron case probably infects many, many more people. Now, having said that, we do know that the third wave is well and truly here. There is festival season. People are kind of tired of COVID-appropriate behavior. And that's probably what is leading to this massive sudden rise in cases. All right, we've got the Christmas festivities, the New Year festivities. The governments can at best say that we will impose 144 section highlights or ban activities, but people have to be responsible. It's the people who are going to these activities. I think they need to realize that though the infectivity is here, though the mortality rates are much lower because we've been double vaccinated, I think it's a very, very welcome move that the Prime Minister has allowed booster doses. But the effect, whether it will prevent the third wave, I don't think so.
So it'll essentially help, hopefully keep the more vulnerable safer, help keep frontline and, healthcare workers safer. Also, vaccinations for 15 to 18-year-old. Dr. Sulfi Nuhu, your, reaction to all these developments that are taking place and the vaccinations for youngsters. We're still waiting for more information on that, isn't it? Which vaccines are going to be a part of that vaccine drive?
Yeah, exactly. We need to get a lot of information on the booster dose as well as especially on the kids vaccine. So definitely it's a welcome move, but we have to wait for that. Having said that, it's very, very relevant that a third wave may occur, the festival season is coming up and we have to be very, very careful. But one thing is sure, and what I have to say is that the Omicron variant, if it is mild and if it remains milder, unlike Delta variant, it may not create a very dreadful third wave, but it's a probability. But we cannot say at the moment the third wave is coming or not. But definitely we have to be careful during this festival season, and we have to at least we have to obey this thing, the COVID appropriate behavior.
The third wave, if Omicron is here, and given what we're seeing in other parts of the world, cases are going to rise up exponentially. Given how quickly they double with the Omicron variant, yes, perhaps hospitalizations hopefully are not going to go up as much, but there's still a fear, isn't it, Dr. Nuhu, that with our absolute numbers, given our huge population, that's still a huge worry, the burden to the healthcare facilities.
Absolutely, that is exactly precisely that is the point. We have to many people in the world, many scientists in the world believe that even the Omicron variant may facilitate it will increase the chance of making the pandemic end. But having said that, in India, in our population density, our total population, considering all those things, and our healthcare availability of our healthcare facilities in remote parts of the country, we have to be definitely very careful. There are a lot of unknown things. There are a lot of unknown things as far as COVID-19 is concerned, especially on the Omicron variant. So we have to be very, very careful.
I mean, even if it's mild, it could perhaps still, cause long COVID.
Absolutely.
A lot of those things we still need to understand. Dr. Arun Gupta, if we take a look at what's happening around the world, there have been these anecdotal reports or news reports saying that more children are being hospitalized. At first in South Africa, where the cases rose and have come down, and then in New York as well. Now there are reports that more children are being hospitalized. But is this just because of the sheer numbers? What do we know?
Yeah, that's absolutely right. There are two factors related to Omicron. One, that the infectivity rate is much higher than the Delta one. That's for sure. And second, its severity is lesser than the Delta waves. But the severity is less only in the term of number of percentage of the patient you get the infection. But when you get a sheer number of cases, which is much larger than the Delta wave, the sheer number of pressure on the health system would be actually almost all equal to the Delta or maybe higher. Because even in the last 24 to 48 hours, there has been rise of 20% hospitalization in the US as well. And the ICU beds are filling up very fast. So considering the huge population of India and the density of the population in India, even if it's much milder than Delta wave, still it can pose a lot of pressure on the healthcare system. So I think all the government need to be buckled up, and especially in Delhi, we are planning and we are anticipating everything, and we are ready for that. And already there's been possibility to yellow alert from today or maybe tomorrow. So there will be some restrictions on some activities or non-essential activities, and we are preparing for the plan. Maybe if the God forbid Omicron comes in a big way, Delhi is ready to face that issue.
Right. You're talking about the yellow alert that will, kick in Delhi if the positivity rate remains high. And this is something that was arrived at by the task force. It's kind of a, automatic thing that goes into effect if the positivity rate is high for a few consecutive days. If you could just tell us about that, because this is something that a lot of thought has gone into, and to prevent more rising cases.
Yes. These things came into being when the Delta wave hit Delhi maybe 6 or 7 months back. So we planned something so that we are prepared, and there's some objective criteria to how to tackle the situation. So there is called GRAP, Graded Response Action Plan. They have 4 colors assigned to it: yellow, amber, and red or something. And yellow is when we really start getting things higher in a number of cases, and some other criteria is there. And yellow means if the positivity remains 0.5 for 2 consecutive days, and some of the activities like you stop school, colleges, there's a night curfew, and the seating capacity in metros should be reduced to half. It's like non-essential shops have to be closed.
All right. So various measures will kick in if that happens.
They're objectively defined there.
Right. And finally, Dr. Gupta, if you could tell us, what are you hearing about vaccination for children? Do we know which vaccines? We know that Covaxin has been cleared, but as far as we know, the stocks are not that high of Covaxin. So are there other vaccines we're expecting soon?
I think as far as government is concerned, they have just cleared 15 years plus. So that is just an age of 3 years gap, 15 to 18. So I don't think there is a huge requirement of the vaccine, maybe 3 or 4 crore vaccine, and combined capacity of Covaxin is more than 30 crores. Now, having said that, the approval is only for the Covaxin or maybe ZS vaccine. Right now, government is considering only Covaxin. I think Covaxin is good enough stuff so they can easily vaccinate people beyond 15 years. No issue with that.
All right, we'll wait for the final those details to emerge. And Dr. Lakrawala, there was also all this talk of mixing of vaccines providing a better protection. Right now, we're not again very sure, though it seems suggested that whatever you received in your first 2 doses is what you'll get in your booster dose. So is there any thought on mixing vaccines? Right, Dr. Lakrawala, I think you've muted yourself. Yes.
I think government has cleared that this morning only. There will be no mixing of vaccine. The third dose or the booster dose will be the same which you got the 2 initial vaccines.
Oh, I see.
The booster dose will be given 9 months after the second dose. So the requirement of booster dose in first month may not be more than 1 crore or 2 crores.
All right, so no mixing of vaccines probably, Dr.
Yes,
Lakrawala.
yes.
So this is something that, people have been talking about that improves immunity, and for the moment at least it seems we're sticking to, the same doses.
Yeah, but the mixing of vaccines, which has been done, at least in the UK study, where the Covishield or the AstraZeneca vaccine has been mixed with the Pfizer, has shown enhanced immunity. Well, in India, we've not yet had any study which shows a mixing of vaccine between the Covaxin and the Covishield. So those results, right now, like Dr. Gupta said, the government is only allowing the same vaccine to be taken, and the booster dose, of course, only 9 months and later.
All right, but hopefully we will get more vaccines in our kitty as well.
Yeah, hopefully the Novavax or the new vaccine should get cleared for use, especially in children, because I think that's the vaccine which has been tested in children and has been proved to be efficacious besides the Covaxin.
All right. Well, thank you so much, doctors, for joining us this morning on the program. And really, that is, I think, what we all need to just be a little careful right now, given the increasing cases. And while the government is making certain rules and restrictions, you know, it's for everyone to keep themselves safe and not venture out if they feel unwell. Thank you, doctors, for joining us on the program.